let's really quickly go over a way for you to teach your patients and clients how to tighten the abdominal muscles during exercises. You know, a lot of times we're trying to teach people this concept of, you know, quote, core activation. But of course that term is very vague and not everybody can pick up on that. And what's more is when we describe how this is supposed to feel, not everybody can get this based on just auditory cueing. So we can't just tell somebody, your stomach should tighten in here, but not here. You shouldn't feel yourself pushing down. Sometimes it's just really confusing for people, and describing what they should feel doesn't necessarily go very well. So here's another way for you to do that, and give your patients or your clients an opportunity to just feel things during a movement. Create the environment for them rather than just trying to describe everything and expecting them to catch it. So one really easy way to do this is to just have them stand and pull a band or cable towards them. Okay, so all they're going to do is wrap this around something, and this is just a regular band here, and all I'm going to do is just stand here, relax everything, and then I'm just going to pull towards me, and then I'm going to let go. And this is all that you have to do. When you pull this band down, your abdominals will reflexively tighten. And all you do is just go back and forth and just ask them to kind of check in and have them tell you what they feel. And then once they get the concept of, okay, I actually do feel my abdominals tighten here, then what we can do is we can have them pull back, kind of focus in on that feeling, and then they let go and they try to maintain it. And they pull back, check it again, focus on it, maintain it. So here's just a way for us to give them a simple movement to do, and it gives them that reflexive abdominal contraction. Now, believe it or not, there are going to be some people that have a hard time even with that cue because they're standing, and sometimes people have a hard time differentiating or dissociating, one contraction from another. So in other words, they feel like they can't quite break apart the feeling of what do I feel in my legs, my quads, my calves, my hamstrings, my shoulders. I kind of just feel everything. I don't really have the ability to just focus in on my stomach. Well, then what we can do is we can take what might seem like an easy movement, but for some people that have motor control difficulty, it's kind of complex because they're standing. You can have them lay down on their back, and in this position, they just bend their knees, and they're gonna lie on their back here, and it's pretty easy for people to just relax everything in this position. So the first thing you'll do is you'll have them kind of relax and just focus on, you can even teach a contract relax technique so they can actually relax all their muscles. And then what you'll do is you'll just have them hold their hands on top of the ball here, and then all they're going to do is just press down into the ball with their arms, and then release. And then press down into the ball and release. And again, the focus here is to have them tell you what they feel in their stomach muscles. And then you press, and then once they sort of get that cue, and they can actually feel those abdominals contract, and then you just ask them to maintain it when they release their hands. If they have difficulty, push down again, have them hold, and then have them maintain as they release. One last trick is, what you'll find is that sometimes when you're trying to teach control of a muscle, it's actually a very helpful cue when you fatigue the muscle. Because when the muscle starts to fatigue, sometimes it starts to give you that burning feeling, and then it's a lot easier for people to cue in on that. So if I'm still having difficulty here, what I'll do is I'll have them push down and hold, and I'm gonna do this in the seated position now, which is another position. And I'm just gonna push down and hold, and I can have them hold this for 20, 30, 60 seconds, as long as it takes before they say, okay, my stomach's getting pretty exhausted. And then I say, okay, so now that we have that feeling here, let's focus in on actually being able to relax it and then contract it again. And then we can go back to this method, push down, hold, and then release. That's usually, if I'm failing at every other kind of method I've got here, if I fatigue the muscle, no matter what it is, abdominals, maybe we're working on gluteal control. If we fatigue the muscle, get that sort of burning sensation that we get in the acute phase of a muscle contraction when it's fatigued, then we can use that as sort of a window for them to be able to maintain that sensation and then go back and forth from that contraction. So there's a couple cues for you. I hope you find them helpful. Happy New Year.